Hello, I'm Andy Reynolds, Master of Ceremonies at NCQA's Health Innovation Summit 2024. MRO is a champion sponsor of the summit, and to learn more about the company's work to improve healthcare, I'm speaking with MRO's National Director of Health Plan Sales, Brad Hawkins. Brad, welcome.
Thanks, Andy. I appreciate the opportunity to speak with you. Always good to chat with NCQA and excited to cover some of the topics and findings from the recent summit.
Well, I'd like to discuss digital quality with you, and I'm curious about your work, your impact, and what you see coming in digital quality. So I'll ask you three questions. What, so what, and now what? So let's start at the beginning. Brad, what is MRO doing to improve digital quality care?
Yeah, no, happy to answer that question. So I think we kind of start with, why do we need to improve digital quality care? So let's talk a little bit about like how we see the market, right? So we know that 10,000 Americans are turning 65 every day until 2030. What does that lead to, right? It leads to a massive growth and adoption of Medicare Advantage plans, the desire for health plans across the board to get more and more data on their constituents, on their membership, right? And so, as you look at just the number of audits that providers are having to handle from risk adjustment to HEDIS year to year is increasing 20 to 30% per health plan. So every health plan or payer out there in the market saying, I need to get more and more data. We had the promise, right, that interoperability, FHIR, APIs is going to solve that problem. And certainly it solves a portion of it, Andy, but it's not solving sort of the entire equation, right? Or as Paul Harvey would say, the rest of the story. I think for us at MRO, right, 22 years in business, 3,000 employees who wake up every day thinking about how do we accelerate clinical data exchange between the provider that we've worked traditionally with and health plans who were looking to provide more value, to just not provide the data, but to really kind of cross that chasm to say it's more about the quality of information that we're receiving and how do you ensure digital quality, right? And I'm happy to kind of dive into that. But I think we're going through a massive clinical transformation, right? We see that, quality data, data validated, DAV data from NCQA, right, is going to have an important and really meaningful impact on patient care. But we've got to sort of realize that, that vision is about adopting new technologies and doing things differently than we've always done it. And MRO is here to partner with sort of, I'll say, both sides of the aisle in order to achieve that. And that's been a big part of our focus.
Got it. Thank you for the what. Why don't we move on to the so what, where we like to drill into impact. So how do you know that you're improving digital quality, or how do you assess MRO's impact?
Yeah, when I think about this whole concept of, sort of digital quality, really at the crux of it, Andy, is, as you may, agree or disagree, is really health information exchange, right? And so going back to the early days of Brad Hawkins in healthcare, the turn of the century, a lot of the focus in that time was around, RIOs or regional health information organizations, or, in Canada, they had local health integration networks or LINs or CHINs or any number of TLA or three-letter acronym to describe health data exchange. And ultimately, you could debate that a lot of HIEs have not proven as valuable as they at least were promised early on around that data exchange component. When you start thinking about digital quality and really sort of a value exchange, it's really between that payer and that provider, right? They're both incented to exchange that data in a more collaborative approach, reducing a lot of that abrasion. And so I think what's important as we think about why digital quality is, we've got this sort of immense potential, right, kind of in front of us if we are able to adopt, validated and interoperability data, sort of data standards, because that quality data is going to lead to quality care. And so for us at MRO, it's not just about adopting and being on the forefront of all of the integration capabilities that EHRs and others are sort of offering, but then how do we ensure that we've got quality data being shared? Because that's really at sort of that the crux of that value exchange, right? Health information exchange has failed in a lot of cases, Andy, because there was a lack of trust between the Baptist or the Methodist or the Catholics or the independent hospitals, right? And like, why would I share data with Andy? It's my information. But in this new world of sort of a payer and provider collaboration space, I think we're finally going to realize that if we can adopt the right data standards and open those lines of communication, then that digital quality is there. where it can be there, right? Not through without a lot of heavy lifting and effort, but it's certainly possible. I think one of the things that we even heard at the NCQA summit recently is that when those payers and providers collaborate, right, it leads to better decisions, more coordinated care. And if we think about timely and coordinated care, does that also allow us to hit some of our performance standards and some of the measurements, right? Because it's good to put that on a scoreboard, but if we're not working to score and sort of align to what how the game's played, then I think we're missing the boat.
Right. By the way, Brad, I like your use of metaphor between religious war and putting points on the scoreboard. It's easy to follow, so thank you for that. For those
Yeah,
of us
no
who are
problem.
not, you've walked us through the big picture. What is the big idea? The so what, that is your impact. Looking ahead, let's talk about now what. What do you recommend people who care about healthcare quality and digital quality? What do you recommend they should do now? Or what do you want them to know about digital quality moving forward?
I mean, I think now is the time that if you're interested in this and this hits your desk in any way, like please don't be a passive individual, right? We've made so many strides in healthcare when we have people who, sort of take up the shield and move forward with what we've got and kind of what's out there. I think a lot of times, and I find this across the board, Andy, in all walks of life, right? It's not that we don't want to do a good job or we don't want to do the work. It's sometimes we just don't know how, right? And I think that was pretty resident and resonated a lot in the conversations, in the hallways, at the vendor booths, and the sessions at NCQA, because the yellow brick road has not been sort of outlined, right, on how to get to Oz. I think obviously NCQA's published the digital maturity model, and that's giving sort of a great path of, hey, this is the first step off the dock, right, that you can take and sort of moving forward. And I think that's going to allow a lot of individuals to start taking those crawl, walk, run measures as you think about moving into sort of the quality digital measurement arena. Key things that are easy to sort of tackle in this world, right, is, let's educate ourselves. If you don't know what FHIR is, not Fire Festival, but the FHIR, how does that differ from HL7? Is TEFCA just a Wordle word, or is it a real thing? Like, how do we start to adopt some of these I would say, sort of the new regime? What is coming down the tunnel, or what's around the bend, right? Kind of skating to where the puck's going to be. I think the stuff that needs to happen, right? We need to educate ourselves. We need to have a conversation at the table on both the payer and the provider side, right? How are we getting quality data? How are we solving some of these, really, I would say, at the grassroots level challenges that us, I'll say, X, Y, and Z EHR, just because you use the same one I use doesn't mean we document in the same place, right? So that's a challenge for a payer who's trying to get feeds from two different providers. You would think, well, the banner over the EHR says X, so it should just come the same, but that's not the case, right? So how are you troubleshooting some of that work while we're, hoping that we've got the easy button coming down the road? But right now, I think it's time to take action and start to really dive in and not just sit back and lament. Man, it would be great, Andy, if we could get great, digital, like quality data in a digital manner, but do something about it, right? So I think number one, educate yourself. Number two, have collaborative relationships and discussions with the other side of the aisle, right? If you're not sending the data that they're looking for, then let's figure out how we can get that data to them. Payer, do you understand the challenges that this provider has in getting this information to you? So how do you work through, some of those challenges? But I think it's definitely the right time to take action. I don't think we've ever gotten anywhere in healthcare when we kind of sat back and waited, right? We'll be here in another 5 years having the same conversations.
Thank you. You've walked us through the big picture, the big idea, the what, the so what, and now what is your look ahead, the recommendations that you just gave us. I wonder if you could zoom out even more. And I'd like to pin you down to a theme, or in just a few words, what is your take on digital quality? And I'll ask you to do that by completing a particular statement. Here it is. Nothing in digital quality makes sense except in light of what? Fill in the blank, please. Nothing in digital quality makes sense except in light of what?
Improving interoperability standards, although I think my caveat, that's just a few words, but I'm going to give a caveat, colon, or hyphen, I'll say, is that, although the interoperability standards have changed and adapted and we're further ahead of where we used to be, that's not, the end all be all, but I would say it's going to be the improvement that we've made, and let's see, at least say interoperability standards or mandates, right? That we're telling these EHR providers that you've got to come out and start to share the data out. And then I think really, truly data validation processes, the DAV program through NCQA, doing the crosswalk and the data standardization, even though it's not, flip a switch and it's there, but taking the time to really understand what's on both sides of that equation. I think that's where we start to really realize that, hey, I'm able to get the data out faster, more efficient. I'm also able to match, where am I missing from a data validation standpoint, the quality of information and what's actually being documented by the provider.
I'm curious for your take on myths and misunderstandings in the healthcare world. What do you find most people get wrong about digital quality and data validation?
I think we get lost in the how we do it, not the what it is. I think that we get a little bit glazed over in PowerPoint presentations and pithy salespeople like myself who might make a comment about an API is an application program interface. It is not another person involved, right? When we think about TLAs, right? So those are different things, right? HL7 is an antiquated way to exchange data in a lot of ways. CCDAs do not completely give you the complete picture, although it's in the definition of a CCDA, right? So there's still, unstructured data elements and whatnot. We're sort of confused by the how do we make it happen, not the what we're doing. And so what is it that we're doing, right? Let's leverage integration and interoperability where we can. Let's build those integrations to the long tail of EHRs that don't have an app store or don't, sort of sell their data to payers, right? Or the access to data for payers. So like thinking about it more globally. Go do that work and be able to, sort of think about what are we trying to achieve and what is it? We're trying to give you the highest quality chart on Andy as possible because that's what you requested. And if we do that, we believe we're going to get what? Timely, coordinated care, better outcomes, better measurement to standards, right? So it's a little bit of the circle of life. I just find that a lot of times I see these presentations, and I probably have given a few where you're trying to, turn into a school teacher and educate the market on the world of APIs and FHIR and everything else. Valuable. It's important for us to understand it. But at the end of the day, what's the value? Is if that makes it more efficient to give quality data and to reach digital quality, then by all means, we've got it, right? But API standalone doesn't do anything, right? What is it doing? It's providing a better sort of outcome or capability of seeing digital quality at scale. So I think sometimes we have a misunderstanding of the what, or the how, not the what.
Yeah, that's interesting. What do you know now about digital quality and data validation that you didn't know X number of years ago?
I have a 15-year-old son who would say I missed the first 7 years of his life trying to sell HIEs across the globe, right? Thinking that that's going to solve world hunger if we can just set up, interfaces or portals or, connectivity. I also realize, if you think about health information management, revenue cycle departments, digital quality, teams that are so much at the crux of being the custodian of the record and honoring, the patient's wishes of where their record can go, right? We've seen a lot of sort of changes in that world. I think you cannot speak enough of, engaging the clinicians in this process around if you've got, folks on your team, and I'm lucky to say that I do, where they're, clinicians who have been at the bedside, who understand what it's like to document in X, Y, and Z EHR, who understand the challenges of, why did immunizations go down or why didn't we, capture certain, data elements and understand what's at the crux, the root level of some of the documentation issues, right? Or sort of getting that documentation there. Once it's sort of there and you've been able to educate and work with those providers, I think, for me, if I had to go back in time, other than the hoverboard, I definitely would be focusing early out of the gate on value exchange, not just data exchange. And the value is only there once you've got the data at a high validity.
Brad Hawkins of MRO. Thank you for speaking with me, and thank you and your colleagues at MRO for being champion sponsors at the Health Innovation Summit 2024. All of us at NCQA appreciate your help and appreciate your insight.
No, we appreciate it, Andy. Thank you so much. And I hope this was valuable for the folks out there. Thank you so much.
Thank you.